Live on Your Health tonight, misinformation about the measles vaccine. There's a new study that suggests in the United States it is spreading almost as fast as the virus itself. Joining us now is Dr. Daniel Koritzkis, Chief of Infectious Diseases at Brigham and Women's Hospital. Always wonderful to see you, Doctor.
Great to see you, Doctor. Welcome back. Good to see you. So let's start with the latest data. CDC now confirms nearly 900 cases, 884 so far in 30 states, and 3 people have died. About 11% have been hospitalized. Are you surprised there have been no cases yet here in Massachusetts?
Well, Ed, Maria, it's great to be back with you. We're very fortunate here in Massachusetts that our vaccination rates are so high, but that's no guarantee that we'll continue to get away without having any cases, because we know that the vaccine, although very effective, is only about 97 or 98%. So there's still a small chance that people could get measles. And the more exposures there are, the greater the chance that somebody is going to end up coming down with it. So we have to still be on our guard.
So last year, around 92% of kindergartners received the MMR shot. It's MRR? MMR.
MMR.
Yes, okay, so there's a new study that predicts if that rate stays the same, we could see almost 900,000 new cases of measles in the next 25 years. If it drops by 10%, we'll see 11 million cases. If it drops in half, get ready for 51 million. That's a huge number. What does that mean for you and your colleagues, Doctor?
Well, it's really concerning. First of all, we know that there's a risk of death from measles. Around 1 to 2% in low-income countries may see death. And if we have a large unvaccinated population, that would be the biggest risk. The second concern is we have a much larger group of immunocompromised people nowadays than we did, say, 5 decades ago when measles was still very prevalent. And there are many more serious complications that can occur in immunocompromised individuals who come down with measles. That would be a big worry.
And misinformation is always bad. Do you agree that misinformation about the vaccine is a big factor?
I think people really need to understand that these vaccines are incredibly safe. We have a new 7-month-old granddaughter, and she just got vaccinated because she's traveling, and we wanted to make sure that she's going to be protected. People should be confident in the safety of these vaccines.
And Doctor, before we step aside,
you know what he's going to say. I already know.
Wait a minute. Let's just say hypothetically that you're a plus 50 male who works on television and anchors, and had gotten this.
Okay.
Well, I'll get to that in a minute.
Okay.
And had gotten this shot a little while ago. That person doesn't have to worry about it again, does that person? I mean, it's hypothetical, right?
Well, so people born before 63 are presumed to have had measles and are protected. People born after 1969 should have received 2 measles vaccines.
We're all set.
You solved it.
We're all set.
I mean, the hypothetical you solved.
Congratulations on your grandchild. And you want to talk to him about the things behind him?
Did you add Taylor Swift to that collection behind you, or yes or no?
Not yet, but I didn't want to disappoint you and made sure that I had the right
Oh,
guy.
no, we love it.
I love it.
It's always great. You feel like an old friend. We always appreciate your wisdom, and we always enjoy talking to you, Dr. Koritzkis. Thank you so much.
Have a good weekend.
All right.
Always a pleasure.